Have you gone to the doctor recently because of pain throughout your body for which there seems to be no relief? Introducing Dr. Anthony Pinozo. The Dr. Pinozo Sports and Medicine Hour will bring you a new technique to resolve painful issues throughout the body. Dr. Pinozo has worked with over 65,000 patients over 40 years and has developed a revolutionary approach to pain treatment. This treatment allows fast and effective treatment of pain without narcotics, surgery, and physical therapy. There is no manipulation or alternative approaches. Weight bearing and the return of normal range of motion without pain is the best kept secret this man has to deliver. So, get ready to call in and ask all of your painful questions and get the answers you've been looking for. Now, here's today's edition of Dr. Pinozo's Sports and Medicine Hour.
Good morning, everybody, and welcome to another show with Dr. Anthony Pinozo. Doc, how you doing?
Doing fine, thank you.
Well, I came over by your office a couple of days ago, and my God, how do you handle all those people at one time?
One at a time, that's what you do.
Well, you know, the funny thing about it is every time I come in, there are new patients. Is that the reason because you do what?
Well, I tell you, my philosophy is that everybody gets what they need. We don't give everybody everything they need when we see them. So that means if you have to wait a little bit, it's still worth it.
Oh, I agree. If anyone out there wants to talk to Dr. Pinozo, the lines are open now at 877-927-6969. Today's going to be a different kind of a show. We're going to be talking about a lot of stuff. Dr. Pinozo, tell me why people go for surgeries that they don't need. I mean, we'll talk about back surgery and all the different surgeries as we go on to the show. What causes people to do this without any reason?
Well, they don't consider their surgeries not needed, first of all. When you go to a surgeon, they are well trained to replace or modify by surgery an existing problem. So, if you go to a knee surgeon, he's going to replace your knee. Just take it right off, put a metal one in. But that's not his problem. His problem is getting you through the surgery and no infection. That's his problem.
Okay.
Your problem as a patient is to look around before you do that. And so if you're taken in by some name out there, some knee replacement specialist, remember the hospitals provide the surgery suites for these, and they have big budgets to advertise, and that's what they do.
So in other words, what I'm understanding is a lot of times that people go in for hip surgery, and just to give you some numbers here out, folks, there are 332,000 in the United States of people that go in for hip surgery, and almost 30% of those people are not really fixed, and they're being sued, the companies that do the replacement. Why are they not being fixed?
They are being fixed, but remember, every time you operate, they don't get infected anymore like they used to. I mean, each operating room costs $100,000 probably to make sure there's no bacteria floating around.
Wow.
So they solved that problem a long time ago. But afterwards, if you have a pain there, it's hard to know why you have a pain. We have treated these, and usually it's just scar tissue around the area. If you can find the right area doing the pain, and we do it by examination, palpation. We have our methods of finding it. Then we just put a shot in it of an anti-inflammatory, which softens that connective tissue inside, and that pain disappears. The range of motion improves. It works just like that, folks. I'm not making this up.
Well, I know it's amazing because people.
So most of these things are not should not be sued because they're not a bad job. It's just that you have scar tissue. Now here's actually what you're dealing with. I don't know if you can see this. There you are. Now the hip joint is underneath all this. This is all the connective tissue that controls the hip. There is the hip, in the hip joint itself, you have cartilage, but that never goes bad. There is no, can you listen to this now? There is no pain fibers within the joint. So where is the pain then? And that's what you get operated for. You get operated for pain. The pain is in this ligament structure around it. That's where the pain is. Now, when you injure one of these, you get scar tissue, inflammation, a sprain. A sprain right here will give you a hip pain. So if we can find that with our methods, we have a fluoroscope and so forth, we can put a shot in that, and that'll relieve it and improve the range of motion. So that that's what you should be doing. Instead of going to a surgeon first, you go to a musculoskeletal specialist like me, and then we kind of we're able to treat that. At least you've given it the best try. Remember, when you get operated like this, it's 6 months to a year of your life.
Well, it's amazing. So, anyone, if you're thinking or contemplating going in for back surgery or hip surgery, why don't you call up today and and Dr. Pinozo will answer all your questions at 877-927.
Call me.
6969. Or if you want Dr. Pinozo to answer the phone right now on the air, you can call him at 561-381-5800. Again, the call-in number today is 877-927-6969. You know, Doc, I was reading an article on the internet where everyone else could read if they want, and they say once you get that surgery, here's what you're going to expect. It's going to be months of drugs, pain, discomfort, and mobility. So a person could go like a couple of months without ever being able to walk again. So why?
Well, there is scar tissue. There is a process of getting used to it and helping it heal over. The less you do, actually, the worse it gets. So we promote activity all the time. But our method is to go in there and find out where that pain is, do something with it, and so we don't use a lot of therapy because they have to be guided on where the therapy goes. You can't just do therapy. I mean, what is that?
I think a call's coming right now on his cell phone.
Walking alone is not going to help you because if it's painful.
Here goes. The doctor's already getting a phone call. Amazing, right, folks? That people don't realize that, you could call him up and make your appointment right now on the phone as we're on the air, or you could call him now, ask a question. He's willing to take the time. His number, our number here at the station is 877-927-6969. And it's very funny because people are going on to drpinozo.tv, his website, and they're constantly typing in questions for the doctor, which I think is great. So, Doc, let me ask you a question. Is that a person just called?
Yeah, I'm returning the call. It's from 561 number.
Okay. So I think what we're going to do now, folks, is we're going to take a little break, let the doc answer his phone call, and let everyone be happy. So we're going to take a break.
It's Dr. Pinozo.
Have you ever had a business idea that you thought would be a great solution to tough challenges in today's world but have no idea of how to get started? You don't want to waste investment money on ideas that just don't work. Introducing Health and Wealth Seminars, a sophisticated advertising agency with over 40 years in the ad business. What makes Health and Wealth different from other agencies is that they fit your product into the public's need. They help put together the strategy of your business before you commit thousands of dollars just to find out that those ideas don't work. Health and Wealth Seminars carries advertising contracts, radio and television contracts, and even a production service contract that will cover all of your business needs. Call today, 954-303-9563, and let Health and Wealth Seminars carry your business to the next level. The number is 954-303-9563. And remember that what happens when you don't advertise is nothing. 954-303-9563 is the number you need to get your business started in the right direction. You're listening to Dr. Pinozo's Sports and Medicine Hour with Dr. Anthony Pinozo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pinozo now at 1-877-927-6969 to get your pain issues resolved. And now, more of Dr. Pinozo's Sports and Medicine Hour.
Well, we're back again, folks. Again, that number to ask Dr. Pinozo any questions you want is 877-927-6969. 6969. Now, if you're shy, you can call Dr. Pinozo right on his phone anytime, today, tomorrow, the next day at 561-381-5800. Now, a lot of people I know, Doc, are going to chiropractors, they're going to orthopedic surgeons, they're going to podiatrists, and they're going to all kinds of rehab facilities. Tell me why this is something that you should be involved in before they go in for any of this. Tell me the difference between what chiropractors do. You've already told me what an orthopedic surgeon does. Tell me what the others do.
Well, they do their what we call ancillary treatment.
Okay.
But the only thing you have to understand is that you need a proper diagnosis before the treatment's going to work. So some of these chiropractors have very good results. But if you don't, in 2 or 3 visits, then you're in the wrong office.
Okay.
I would think. And why? Because the diagnosis is not proper, so therefore the treatment can't be proper. Now, we specialize in making a proper diagnosis. That's why we have good results, because the diagnosis is secure. We don't do anything until we have it, and then we act on it. So that's why we say you can't leave the office with the same pain you walked in with. You can leave with another pain, but not the same one. And so we will work until that pain is gone. That means a proper diagnosis and a proper treatment. And that pain leaves, and it does not come back.
So in other words, if I'm understanding this correctly, somebody comes in and they cannot leave that office until that pain has gone away.
That's right.
I don't think any chiropractor that I know, I'm not gonna badmouth a chiropractor, or any rehab facilities can really say that.
Well, we don't equate ourselves with them. We have a very, very high standard to meet.
I understand.
And we meet that standard. That's why we're busy, because we do meet that standard. But it's a very high standard. It's not something that we're going to treat you, and if you get better, okay. Otherwise, you don't. We are making sure you're getting better.
Now, Doc, something that a lot of people we seem to always forget is most insurance companies do take what you do. So in other words, someone comes in, if they have Blue Cross or they have any of the insurance, you do take insurance.
Oh yeah, we take insurance.
Okay, and there's no problem then. Okay, so folks, if you're thinking of going in for any type of surgery, I think the best thing to do is you have 2 options. One, you could call Dr. Pinozo on the cell phone at 561-381-5800, or call our hotline today where Dr. Pinozo will answer a lot of your questions. That's 877-927-6969. Or if you like, about 20 people who have names here right now who have gone to Pinozo.tv and have written in questions. Doc, you want to take a couple of those questions?
Sure.
Now, I'd like to take the ones that we were talking about as far as the back surgery. So let me get to my first one here. Let's see if I got that the right way. Okay. A lady writes in that she has gone for back surgery. She doesn't want me to give her name out, even though she put it, and she's having more problems now than she had before. She said she is a 54-year-old female who had an uncemented left THR, which I don't know what that is, and now she has problems with the hip socket. Could you help her?
Well, oh sure. Again, it's a diagnosis problem.
Okay.
Isn't it? So we know that anything over the hip is probably could come from the back, but it could be from the hip also. So the examination would eliminate the hip as a suspect, and then we would look at the back. We would look for equal of weight bearing. In other words, it's an engineering concept rather than medical. In other words, MRI is not going to help you here. We have to know which structure is involved and why it's that way. So we do a special standing up film, and the interpretation is particular to us. We could pick out where the problem is on a clinical basis and the history. In other words, where does that pain go? Why does it go there? Where is it from? And then we look at the film, and then we determine how to approach it so we can treat it. And then we expect to get a 100% cure rate.
Now, why doesn't the orthopedic surgeon do this?
Well, they're not trained that way. Remember, they're not trained to treat these things. They're trained to take them out and replace them. So you have to know who you're going to when you go. When you ask for help, you got to know who you're asking for help for. I mean, if you want a brick house, you're not going to go to a carpenter. They don't do that. See, so that's an obvious thing. If you have a Rolls Royce, don't go to a Chevy dealer. You know,
I don't think I think you have a problem with that one right away.
you want to go to the best you can get for yourself, no matter what it costs. Remember, it's you. Take care of yourself first.
And she also said that she was in the hospital post-surgery due to blood loss, nausea, and pain. And she says she's a very active person, and it's bothering her now that she is on crutches to ambulate. I guess that's if she had gone to
Yeah,
you.
well, we would like to see her now.
Yeah.
So let's go on to the next one. Why don't
Okay.
you call in, make an appointment, and we'll take care of this for you. If you're in the area, I don't know.
Yeah, she is actually. She's in Boca Raton. So, what I'd like you to do, to answer that question, call in today, and Doctor will answer that question at 877-927-6969. Another way. Well, before we go on to any more questions, Doc, one of the things that has always bothered me. Why are all these people that are going in for hip replacement being sued? I mean, you go into the internet and I went to Google, and there are lawyers that have popped up for all these people that have faulty, I guess, plates that were put in. I don't even know what they put in. Explain to me what goes into that hip replacement that's causing all these problems that they're being sued for.
Well, I don't think that being sued is proper because these hips are they're almost foolproof. Once they're in there, they're being sued for pain. Is what they're being sued for.
Okay.
Now they're making it up why the pain is there, but believe me, it's just scar tissue. I've seen enough of these. We treat them all the time, and relieve the surgeon from that burden. I mean, they really ought to refer these people to us before they go to a lawyer. I mean, it's a tragic thing. Yeah, we once that surgery is done, every time you cut into the body, you got scar tissue, and that's all it is. So once those are treated, that pain leaves. The hips are good.
Well, I have a lady in Wellington. So, Sarah, I want you to take this number down before I even ask your question. 877-927-6969. And Sarah from Wellington writes, I have been in contact with my doctor to have hip replacement surgery next month. I saw your radio show and was wondering if your procedure would fix my problem. Pain and swelling is the main cause, and I've been told it's wear and tear. Will your procedure end my suffering?
Well, of course, we need a diagnosis. In other words, we'd have to take a history of the pain, when you get it, why you get it, and then examination, which is unique to us.
Mm-hmm.
Then we do a unique film and look at the area that we specify as being painful, and then we decide what it is. Now, a lot of times the hip can have the wear and tear changes, but then you have to ask yourself, why this one, not that one? The body is channeling you into that area. Now you have to look at it in a proper way to know why this one hip is bothering you and not the other. It's rare that you have two hips bothering you.
Mm-hmm.
And so usually it's an abnormal weight bearing. So you have to think in those terms. What if you have a short limb there?
Right.
And you're coming down hard on that all the time, bang, bang. And over a period of years, you get scar tissue, which from inflammation, and then you get a pain because that scar tissue won't stretch. It's very simple. Look at it like that. And first thing you know, we can adjust the weight bearing, inject that pain out, and you do really well.
What's amazing to me is why people aren't smart. I don't want to use the word smart, doctor. Why don't people call you? I mean, this to me is a no-brainer. I mean, if you have these problems.
You're assuming they don't.
Well, I know they do because there's 69,000 people that do call you, but we want another 69,000 to understand.
No, they call me. The problem is that what they're told in their articles in the sports magazines and the runners magazines is right out of the orthopedic surgeon's lexicon, which is, I'm just explaining to you how it's faulty. They do not diagnose these problems. They operate them. So what they do, they don't. Let's go back a little bit. They don't do the treatments for these. I do the treatments for these problems, hips and knees. They do the surgery. In other words, who does the treatments for the orthopedic surgeon? The physical therapist.
Okay.
Now, are they trained well that they know what to do? No, they're not. And so their program, if you look at their programs, they're rarely related to what we send them there for.
Okay.
So anyway, that's my experience. If you don't like it, I can't help it. That's my experience.
No, I mean, you're very honest with what a lot of people don't understand is,
All
doctor,
right.
you want to teach.
So we're teaching, and if you want to get better at it, then get better at it. But so right now, we're the only ones who do the musculoskeletal treatment between the technicians and the surgeons.
Well, I have someone from that beautiful city of New York
Oh, beautiful.
who really wants to know, Doc, I had hip surgery done 3 months ago and seem now that the new hip has settled. The problem is that I waited too long and the old hip is acting up. My new hip is no longer the old hip, so I have pad to offset differences. I have no idea what he's saying. I've been watching your show and want to know, how do I avoid surgery again by doing the procedure on the old hip?
Well, you just get it examined and find out what the problem is to check the weight bearing. Remember, weight bearing is a physics problem. You have to understand it's a physics problem. It's weight bearing in motion.
Mm-hmm.
Everything has to move, and if it can't move, then it's painful, right?
Yes,
So
I
you have
agree,
to think
sure.
about, okay, if you can find the painful spot and mobilize it, then it's not painful anymore. So that's the treatment that you should pursue. If you have to fly down from New York, everybody does it. A lot of people do it. Come on down.
So, Tom, let me tell you, if you're thinking of coming down to spend a great place right now in South Florida, call Dr. Pinozzo on his hotline, 561-381-5800. And Dr. Pinozzo is unlike any other doctor that I've ever met, and I'm no youngster, as you can see when you go to Pinozzo.tv. I have to wait and wait. We all have to wait in waiting rooms. Dr. Pinozzo answers his own phone call. Doc, let me ask you a question. That always amazed me. Why do you answer the call?
Well,
Yourself.
Because people want to tell me what their problem is. If I can help them, I will tell them I can help them. If I can't, I will tell them that. And so that we don't have to have somebody come in needlessly. And say it's a simple knee or a simple shoulder. Well, if it's really bad, I can bring them in right now.
Mm-hmm.
And I'll just make room for them. So that's why I do it. It's kind of arranging the patients. You know, sometimes we see 10, 12 people a day. I mean, but some of them are long, some of them are short. So I can do that.
That's amazing. That's amazing.
So make it run smooth, very smooth.
Now we got somebody from that great, oh my God, I'm getting people from Minnesota. Bobby in Minnesota writes, I had hip surgery in January. I'm still walking with a limp and was told I have to keep up my rehab. That's the first part of the question. Tell me, so in other words, what I'm understanding is after he has the hip problem, which was very painful, now he has to keep up with the rehab. Is that normal?
No.
Okay. So you understand that that's not normal.
Put the camera on me.
Okay.
You have to understand the diagnosis is primary. You must know what that pain is. And if they're not telling you, you've got to go somewhere else. You have to know what the pain is from. So you can't get it treated till you know. And they're not telling you. They're just saying, keep going. Don't keep going. Find out what your diagnosis is.
Well, we're going to be coming back for more stuff with Dr. Pinozzo. We're going to take a little break now, and we'll be back in a couple of seconds.
Please welcome a new sponsor to the show. It's AMP2 TV, the first and only internet network that's truly plugged in. When you're looking for a full-service internet television production company, discover AMP2 TV, a full-service production company that can provide all streaming videos in studio or remotely. They offer web page development, and they use all the latest platforms to help make your business selling points more powerful. They can do remotes and live streaming, as well as tape productions. Let AMP2 TV handle all of your television production needs. Choose from a variety of creative TV and radio packages and see why AMP2 TV works with many major companies, including Comcast, Bravo, and Fox 29, as well as individuals and businesses of all types and sizes. To see samples of their work or to find out more, visit their website at amp2.tv. That's AMP, the number 2.tv. Or call them at 1-866-224-5422. That's 866-224-5422.
Pain is the body's way of telling you something is wrong. Surgery can do more harm than good. Pills can become addictive. Dr. Pinozzo uses engineered concepts and weight-bearing physics to resolve this pain and get you greater range of motion. Call today to resolve all those old excuses the medical profession has given you up to now. Call 1-877-927-6969. And now, let's get back to today's show.
Okay, we're back with Dr. Pinozzo. Dr. Pinozzo, on that last call, Bobby from Minnesota said she had complications with surgery and she had infections. Is that normal when you're going for that type of surgery?
No, if you get infections, there's something wrong, either diabetic or something else. I don't even want to talk about that.
Okay, that's no problem. I'm going to move on to the next one then. John, right where we are in Delray Beach. John, I want to give you Dr. Pinozzo's number, 561-381-5800. John in Delray said that, let me see if I can read his writing. I was told that if I have time for my body to heal, my herniated disc and body will take care of it. Is this true?
No.
Okay. Okay. That's short and sweet, John. So we can't get any better than that.
Well, only that if you have enough time. But who has enough time? If you can get it done quicker, I mean, wouldn't you want to do that? Well, we can do that.
And he also says that, will your procedure help my body resolve the pain? Well, we already know the answer. While the body is doing its thing. I don't know what thing he's talking about, but
the body doesn't do its thing. We have to help it do its thing. I mean, it's not going to heal by itself. You don't want the body to take care of a problem by itself, because you have to assume there's something wrong with the engineering problems before that. So if you're going to heal that way, are you improving? I don't think so. And it takes too long.
I think the most important thing that people should understand is if you're having pain, as Dr. Pinozzo said, he can cure that pain. I mean, so to me, that's one of the main reasons to come and see Dr. Pinozzo. You could also, if you're in the neighborhood, you could stop by at 16244 Military Trail in Delray. And, if you're really in pain, believe me, he will actually fit you in. Is that correct, Dr. Pinozzo?
Yeah,
I want to make sure I don't say anything that's...
Yeah, if somebody has, their quality of life is deteriorating, well, we'll try to get them in quicker.
Okay. I have another question here, and this is from Bob in Boca. Bob, I know you took the time to watch drpinozzo.tv, so now is your opportunity to go see Dr. Pinozzo. And here's what he's saying. On January 14th, 2014, I had right total hip replacement. The next morning, I got up walking and was fine, except my left leg was 2 inches shorter. Is that normal, Doc?
No.
Okay.
Okay. It's probably not 2 inches shorter either. There's a special method of measuring that. And
okay. He said that the doctor came and did x-rays and said it was because of my back and pelvis being tilted. So the very, I know you're laughing, and so am I.
That's because the leg is shorter. That's why it's tilted.
So that very morning they had to redo the total hip replacement again. That's something to have 2 hip replacements in the same time. I mean, that's got to be devastating.
I don't know. Do you have anything other than hips? I mean, you must have something else.
I could only tell you what they're writing in. I mean, this is what people are writing in. We could talk about golf if you want.
Yeah, let's do that.
Okay. Just to let everybody know, we're done with hips now. On a little lighter side. Next week, put this in your calendar. Come meet Dr. Pinozzo at the PGA store Sunday, the 30th, as we do our live show. So all you golfers out there that are experiencing pain, Dr. Pinozzo will be live from 11 to 12, and from 12 to 1, he will be there to help you with your swing, analyze your swing. And here's what we're going to be doing, folks. We're going to be giving out free gifts. We're going to have a putting contest, free lessons at the PGA store, and a swing analysis by Dr. Pinozzo. That's March 30th at 11, Sunday, 1040 Linton Boulevard, Delray Beach, the PGA store, where you could actually come, sit down while we're doing our live show, and meet Dr. Anthony Pinozzo. Now, here's a couple of golf questions. Mike, who's a golf pro, I have bulging disc problem and have been informed that surgery is the only way to improve my condition and my golf game. I have been told that with proper rehab, I can be 80% efficient to my old self. This was my livelihood, and those numbers are good, but not what I want. How can I help getting my livelihood back by not having to go in for another surgery? I don't want 80%.
Okay. We would give you a 100% cure rate. And
wow.
That's what we do. And we do it the first day you come in. I take it very seriously that, you need a good swing in order to work. And I'm going to preserve that.
Mm-hmm.
So we don't want to operate you. We don't want another scar tissue on your back. And we will, in a few days, you'll see the big difference.
Wow.
So Yeah, make an appointment. We can handle that. No big deal. We do it every day of the week.
Now, Mike, you're a golf pro, and getting on that same thing, Doc, a lot of people are spending lots of money on golf clubs, which we will find out at the PGA store. Tell me, give me the example of what you do and the art of golf, what each one of you do together.
Okay, well, we work with the PGA Pro, the teacher, very closely. They're the ones who would teach the art of golf. And that means how do you play the course, which clubs to use, and so forth and so on. Things I don't know.
Okay.
What I'm concerned with is the tee. How does your body cooperate with all the parts of it to swing that club head in a 90-degree arc to get that ball straight? This is a very complicated issue, and the PGA professional teachers don't address this at all. In fact, it's not a part of their education, which I'm trying to make it. I'm trying to make it for them, that they understand more of the anatomy and physiology of the golf swing, so they can help more golfers. And it's more than just the spine; it's the hips, knees, shoulders, neck, all of it. All of it works together to get that club head in the proper way. And when it isn't, the PGA professional is going to change your swing to accommodate. But I'm saying, well, let's fix that, and then we don't have to accommodate, and then it'll be normal swing.
Well, that's amazing.
It works just that way, gang. I mean, it absolutely does. Now, how did we do that? We have films of the swing where the pain is before, and then we treat, and then we have films afterwards. And you can see the pain is not there and the swing improves. Now, all the golf professional has to do after that is guide that player into having a normal sequence of events, a normal swing, and to get the, know when to use strength, when not to use strength. And that's their business. The art of golf is the PGA professional business.
So what we're going to try to do when we do our show is have a couple of those people that you've treated to come on down.
Oh, we treat golfers every day.
I know, it's amazing.
They're always coming in because of all those country clubs around us. And you got people who are 80 years old hitting that ball.
I know.
I know Bob Tosky hits it 250 yards, and he's 87, I think. I mean, it's just terrific.
So the clubs are good for the art of golf, and what you're going to do is be able to get them so there's no more pain.
Eliminate the pain and improve the swing is what you want to do, and so you'll play golf more. It's good for the whole industry of golf business, because the more people go in it, everybody does well.
Well, here's a question that you've always been asking me, and someone actually wrote in. I guarantee this is going to be funny, so I'm going to read this slow for everybody. Tiger Woods' future with back pain is creating news all over the golf world, which we know that he's gotten out of so many tournaments. I have the same issue. I cannot swing fully while playing golf. I have seen your show and understand how you remove pain and will increase my mobility. What I don't understand is if you remove the pain in my back, will it return in the future?
The pain does not come back.
Wow.
Once it's treated and the range of motion is improved to normal, it won't. That pain will not come back. So we're looking for the next pain, of course, but you have to understand that whenever we do anything, we write it down in detail, where it is, why it is, and so that's how we know that the pain does not come back.
That's amazing. That's absolutely
It is
amazing,
and it's true, though. It's absolutely true. It's a first-class treatment. This is how I think. This is what we want to do. We don't rest until we get that pain down, and we're going to get it down the same day you come in with it.
So a golfer that's saying to himself, boy, could I use another 20 yards?
Yeah, they can get that. Also, athletes use their body to make a living.
Correct.
And why they trust it to a trainer rather than a physician, I have no idea.
That's a question I always wanted to ask you.
You have an orthopedic surgeon who puts everybody to the trainer. The trainers aren't trained in musculoskeletal medicine. There is no way they can do it.
Repeat what you just said. I want people, they're not trained in...
They're not trained in musculoskeletal medicine. It's an MD. That's me.
Wow.
And they're not trained for that. They're trained as a trainer. So, and the orthopedic surgeon doesn't do this work either. So they do surgery work. So who does the work of the musculoskeletal medicine, the middle guy? Nobody.
So what's really amazing me is so you have a guy like Tiger Woods,
Yes.
who's been #1 forever and now is pulling out of tournaments,
Yeah.
and he could be cured by you.
Yep.
Tiger, if you're out there or you see Dr. Pinozo's commercial nationwide on the Golf Channel, I don't know you, but I think it would behoove you to at least call the doctor. So all of you golfers out there, if you want to call Dr. Pinozo direct and talk to him about what's going on with your golf swing, you can call him at 561-381-5800. We are going to take a break right now, and we will get back with Dr. Anthony Pinozo.
Have you ever had a business idea that you thought would be a great solution to tough challenges in today's world, but have no idea of how to get started? You don't want to waste investment money on ideas that just don't work. Introducing Health and Wealth Seminars, a sophisticated advertising agency with over 40 years in the ad business. What makes Health and Wealth different from other agencies is that they fit your product into the public's need. They help put together the strategy of your business before you commit thousands of dollars just to find out that those ideas don't work. Health and Wealth Seminars carries advertising contracts, radio and television contracts, and even a production service contract that will cover all of your business needs. Call today, 954-303-9563, and let Health and Wealth Seminars carry your business to the next level. The number is 954-303-9563. And remember that what happens when you don't advertise is nothing. 954-303-9563 is the number you need to get your business started in the right direction. Dr. Pinozo is a world leader in helping those who have tried everything to get rid of pain in the body. When surgery or pain medicines aren't working, Dr. Pinozo is here to help. Range of motion increased over 65,000 patients that Dr. Pinozo has helped. And now he's here to help you. Call the show now, 1-877-927-6969, and let him help you get on the road to pain-free health.
Welcome back to the Dr. Pinozo
Yes,
Show.
sir.
And someone has just called in the good doctor and is making an appointment with him right now. So, so if anyone out there has experienced any kind of pain, you could always call Dr. Pinozo at 561-381-5800. And we're going to take a little break now so the doctor could talk to his client.
Please welcome a new sponsor to the show. It's AMP2 TV, the first and only internet network that's truly plugged in. When you're looking for a full-service internet television production company, discover AMP2 TV, a full-service production company that can provide all streaming videos in studio or remotely. They offer web page development, and they use all the latest platforms to help make your business selling points more powerful. They can do remotes and live streaming, as well as tape productions. Let AMP2 TV handle all of your television production needs. Choose from a variety of creative TV and radio packages and see why AMP2 TV works with many major companies, including Comcast, Bravo, and Fox 29, as well as individuals and businesses of all types and sizes. To see samples of their work or to find out more, visit their website at amp2.tv. That's AMP2.TV. Or call them at 1-866-224-5422. That's 866-224-5422.
You're listening to Dr. Pinozo's Sports and Medicine Hour with Dr. Anthony Pinozo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pinozo now at 1-877-927-6969 to get your pain issues resolved. And now, more of Dr. Pinozo's Sports and Medicine Hour.
Well, we're back, and Dr. Pinozo's already...
that was a golf swing problem. Man wanted to get back to swing. He's talking about speed of the club head. Now, you have to... The club head has to get up to, 120 miles an hour, I think.
Yeah, 120 miles.
Some of the current pros run 120 miles an hour or more. So you can get that, but it takes a lot of effort. And you have to be a good athlete. Remember, these pros are good athletes to begin with. And and that's how they do it. It comes natural to them. The golf swing actually should be pretty natural.
But people are still in pain. I mean,
Well, if they're in pain, there's a problem there. But I'm talking about the natural, normal athlete that plays golf, the heavy winners.
Mm-hmm.
They don't have that much pain, and it's the swing is natural to them. It's good.
No, I know. You and I always talk about Tiger Woods. When you watch him, where do you think his problem is? I know it's hard to diagnose somebody just from watching him on TV.
We can't talk about Tiger Woods, but whatever the pain is, we'll know where it is, and it is treatable.
Okay, great. So folks, I'm going to give a little challenge to everyone out there. When we do our show at the PGA, which will be next Sunday between 11 and 1, what I'm going to do now is I'm offering anyone who calls up with a golf problem, either calling on the hotline, 877-927-6969, or calling up Dr. Pinozo, as someone just did, at 561-381-5800. I am going to give you the opportunity to be the first person to enter the putting contest. And what that will allow you to do, if you win, you're going to get a free lesson at the PGA store and a swing analysis from Dr. Anthony Pinozo, as well as 1-year membership to the PGA store. Let me tell you what that really includes. Anytime you bring in your clubs or anything that you need, they will do it for you and not charge you labor. They will also give you the opportunity to use their facility to drive balls, hit balls day and night. So when it's raining out there, Doc, on Sunday, people could come in and hit golf balls. Now, one of the things that always amazed me, I watch people hitting golf balls, Doc, and they're doing everything, as you said, which is funny, to compensate for the pain. How do you analyze that person? Tell me what you do when that person comes in. They come in and say, Doc, I'm having really bad pain in my back. I can't swing the club all the way back.
Well, we just take a history of where it is and when it is, unrelated to golf. So that pain is not just in golf; it's all the time. So we figure that out. Then we have a special film we do, special examination we do. We get a diagnosis. Then we can, if the golf swing is important to this patient, then we have them swing for the camera and record it when that pain occurs. So that, in other words, he's doing this, says, oh, that pain's right there. As I did, that no pain there, pain's right here. Okay, we can diagnose that, eliminate that, then repeat the film, which is going to be pain-free then. And so that's how we do it.
Wow, so in other words, someone comes in, they could be pain-free, they get on the golf course, and then, well, let me ask you a question.
Yeah, people play golf the next day.
Yeah, I mean, that's amazing.
Absolutely the next day.
So let me ask you a question. How about if I'm going to put a challenge out to all your instructors. For all of you instructors that are out there, that are giving lessons, and you do a great job. I cannot take that away from you. You guys are fantastic.
Right.
Why don't we set up something where, why don't you call up Dr. Pinozo? Maybe as a team, we could get those golfers to hit the ball farther, and now you could spend most of your time on teaching them how to hit that 100-yard shot over the water by using a full swing. Do you think that would be a great idea, Doc, if we could do something like that?
This is the goal that we want to do. This is why we're doing this radio show. This is the goal. We want to get the PGA instructors to understand the medical problems a little bit more, get them treated, and then improve the patients, the golfers, because they deserve it. I mean, why did they? You don't want them to waste their money if you can't improve their swing because you don't know why it's deficient. Then that's what I'm trying to bring, a medical science to the golf business. So you work together with the doctor, we train the doctors, get the swings better, and it's going to be better for everybody, really.
So all you people out there that are going to your instructor, I think it would be a good idea to bring Dr. Pinozo there to meet these people. Look, if you're a golfer and you're in pain, I mean, come on, there's nothing worse than having pain when you're playing golf and having to struggle through that. I guess they take some kind of aspirin, Doc, to alleviate that pain, but it doesn't really go away. Am I right?
It won't go away, but we spend a lot of time analyzing how the swing occurs. Take advantage of it, instructors. I mean, send your people in there. Don't let them waste their money. We can eliminate that pain. They go right back to you, and they'll have more lessons. It's good for you.
Okay.
So that you should really do that. We spend a lot of time. This is a science. This is not voodoo. I mean, I use the term voodoo, but
No, you're right. You're right. It's not voodoo. It's
not
real.
that. This is a real science, and like I said, we record where the pain is on film. Then we repeat that swing, and you will not have that pain. And when people look at that, they'll say, "Wow, I can't believe it." Yeah, believe it. You're seeing it right in front of you.
So what? I don't want to use this word. I'm going to say it because I'm not the doctor, and you tell me if I'm doing it right. When they come to see you, you could actually guarantee up to, I want to use the word, up to 40-yard difference. I don't want to say guarantee 40 yards, up to 40-yard difference by just seeing you one time.
Yeah, you'll get some improvement right away, and it depends on what the problem is. What if you have a knee and a shoulder?
Oh, okay, right.
Now you complicate. What about between the shoulder blades like you, Les?
Yeah, exactly, right.
These are all separate problems that have to be treated. So you can't do everything in one day. It's impossible.
No, I want everyone to know that there are other things
But
that
we
can happen.
encouraged playing. I always tell people, look, don't sit around doing nothing. You're not going to get well that way.
Right.
You go out, get that pain, bring it in, we'll fix it, go right back out there, and before you know it, you're out there playing terrific, and I'll take the thanks for it.
Well, yeah, you should take the thanks for it because you know what, and I want to urge all. I know my producer and I are working on something where we're going to have a little meeting at one of the country clubs, and we're going to invite just the golf pros to kind of meet Dr. Pinozzo and to see that, it behooves all you golf pros to give Dr. Pinozzo a call just to talk to him and let him show you how you could make a lot more money by giving lessons now that people don't have the pain. You watch these guys, Doc, and it's like a 30-yard shot, and they do a full swing, the pros, and they know just how to do it with the art of golf, which you don't teach.
That's the art of golf, right?
But once you get that pain away, the art of golf becomes a lot easier, I would assume.
Oh, absolutely. I mean, it becomes de rigueur. I mean, the normal thing.
So if all your people are, don't want to call the hotline, I'm not going to give it anymore because it seems that more people want to call Dr. Pinozzo directly. It would be a great thing for you to come down next Sunday to the PGA Superstore, where you will actually be able to meet the good doctor, ask him questions. We're going to have a little, it's going to be limited to a certain amount of people. You could call up Dr. Pinozzo at 561-381-5800, or you could go to pinozzo.tv, and you could actually register. I'm looking at my producer and making sure I'm saying the right thing to be one of the people that will be invited, because once we fill it up, folks, there's not going to be any more seats. So, again, you could call the good doctor at 561-381-5800, or if you're in the area and you got really bad pain, you could just stop in his office at 16244 Military Trail, the beautiful Delray Beach office. Go to his office at Suite 740, and you know what? You could be cured and be ready to play golf the next day. Am I right, Doc?
Right.
Because when the other beauty of it, they come to your office right before they go to the PGA store. They get a shot because you see that there's something wrong after examining them, and they could be ready for you to analyze them at the PGA store.
Well, we're going to do the analysis there as well as I can do it.
Exactly, and there's just so
I'm
much.
not perfect at this, but
Right.
We learned a lot about. We know why the swing occurs, how it occurs, so we can pick out the deficiency.
Mm-hmm.
What you do about it after that is up to you. If you want us to treat it, we'll treat it. Otherwise,
So basically, when someone comes into the PGA store, and the good doctor at his own expense is going to let you know where he sees pain, then they would make an appointment right there because the doctor could make an appointment for you right there, and they can come in
yeah, we
to
won't.
see you.
There's a no charge. Also, we're not going to charge.
Right? No, just to get the analysis. No, that's great. So, folks, you're going to be able to do what hundreds and hundreds and hundreds of doctors have never done before.
Nobody's ever done this before.
That's amazing.
If you go into the literature, there is nobody that's done this. I have done this in detail, and I'm going to have to publish a book on this, which you can buy on my website.
And, Doctor, you're going to have two golfers there next week to show what you've accomplished. Folks, as always, the time just seems to go by when Dr. Pinozzo gets started. So I want to say to everyone, thank you so much for tuning in. And don't forget, PGA Store next week. Have a great weekend. Take care. Oh, and I'm going to a break. I'm sorry, we're not going. We're going to be back with the doc. I'm just going to a break right now. I'm so sorry.
Have Have you ever had a business idea that you thought would be a great solution to tough challenges in today's world but have no idea of how to get started? You don't want to waste investment money on ideas that just don't work. Introducing Health and Wealth Seminars, a sophisticated advertising agency with over 40 years in the ad business. What makes Health and Wealth different from other agencies is that they fit your product into the public's need. They help put together the strategy of your business before you commit thousands of dollars just to find out that those ideas don't work. Health and Wealth Seminars carries advertising contracts, radio and television contracts, and even a production service contract that will cover all of your business needs. Call today, 954-303-9563, and let Health and Wealth Seminars carry your business to the next level. The number is 954-303-9563. And remember that what happens when you don't advertise is nothing. 954-303-9563 is the number you need to get your business started in the right direction. Pain is the body's way of telling you something is wrong. Surgery can do more harm than good. Pills can become addictive. Dr. Pinozzo uses engineered concepts and weight-bearing physics to resolve this pain and get you greater range of motion. Call today to resolve all those old excuses the medical profession has given you up to now. Call 1-877-927-6969. And now, let's get back to today's show.
Well, we're back with Dr. Anthony Pinozzo, and I have one question that I'd like to ask you, Doc, before we go. It's from Lynn in Texas. Lynn says, I have been diagnosed with symptomatic herniated disc. The disc itself is not painful, but rather the leaking disc is pinching a nerve. This pressures pain called, let's see if I got this right, radicular pain, nerve root pain, leading to pain that may be referred to other parts of my body. I have no idea what she's talking about, but she says her leg hurts, her arm hurts, her neck, and a pinched nerve. The doctor says you have to go in for neck surgery. What would you tell Lynn?
Neck surgery. What about the lower back?
According to Lynn,
neck surgery is not going to take care of the lower back.
Okay, so I'm glad you're answering that for her.
It's a little far for you to come, but these are separate issues. And we would treat them one by one. If the lower back is hurting and the side of the leg, we know where that is, where that's from. The only question then is it primary or secondary? We would determine that, do the proper treatment for that, and you would lose that pain in one day.
Wow. And I want to say to all you fishermen out there who gave up golf because of pain, call Dr. Pinozzo, and he can get back to the swing. You like that word, Doc? Getting into the swing of things?
Getting into the swing of things, yeah. They're giving up golf or fishing.
I don't think he's thinking anything more
not
boring.
As exciting, I don't think.
No, could you imagine sitting there all day on a boat going fishing when you could be on a golf course hitting balls?
Yeah, what happens if you get a big fish and you start pulling it out, you get a backache?
Now what do you do?
Hey, what do you do
when the big fish gets off the thing because you can't pull it in? So, folks, again, we're going to be out with Dr. Anthony Pinozzo at the PGA store, one of the big superstores, and he's going to be doing free evaluations by looking at the way you swing, and then you could actually make an appointment with Dr. Pinozzo to get your swing back. I mean, to me, it's a no-brainer.
Well, it's something you should do. I mean,
if you're a golfer, I mean, my God, why? And you used to be a golfer. Didn't you used to golf?
When I wasn't so busy, but to be a golfer, you have to have time for practice. You have to play, in other words. You have to play 3 days a week.
Yeah?
And I can't do it. Yeah.
So in other words, you're giving up your golf that you did to help other
people. But that's okay.
That's good.
I get a lot of pleasure by treating people because I consider a pain problem like a murder mystery. It's not a murder mystery, but I think of it like that. There are clues. It's an engineering problem. I mean, I use everything I have to diagnose where that pain's from. That's why the results are good, because we spend a lot of time doing that. And so we get better and better at it. And so I really enjoy that kind of work. And so I treat golfers rather than playing golf myself.
And the thing is, you want to teach people how to be pain-free. And
it is a teaching program.
Beautiful.
This is a teaching program. So if you learn something, that's what we're supposed to do.
And you spend most of your life trying to doing this, doctor. You know, with 69,000+ patients. I mean,
Yeah, we're up to 70,000.
70,000 patients that are all happy. So we want to cure one golfer every day. Am I correct?
Yeah, that's a good goal.
So I just want to let everyone know, again, the time seems to go by so fast with Dr. Pinozzo. If you want to get a hold of Dr. Pinozzo directly, you could go to 561-381-5800 or go on Pinozzo.tv and do what everyone's doing, finding out about the good doctor.
Yeah, thanks for tuning in.
Thank you so much. Right, Doc?
Bye.
Have a good one.
This has been the Dr. Pinozzo Sports and Medicine Hour with Dr. Anthony Pinozzo. If you spend 5 minutes with Dr. Pinozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pinozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pinozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pinozzo next week when he brings you more important information on the physics of weight-bearing and engineered concepts for the body.